Step by step, we'll light the way.
Well, thank you, Dr. Contreras. When a patient is working on a diagnosis, there's their body's going through a lot of stress with all the the blood work, of course the thought of even having cancer, biopsies. And that may take 2 weeks, 4 weeks, sometimes even longer,
Sometimes
depending
even
on
longer, yeah.
how long that is, and that's a long time. What can that patient be doing to give them better chances, or build up their immune system to give them some better chances, with outcome, to help out their body as they're going through such a stressful event?
That's an excellent question, and a little bit difficult to answer because it is a very stressful time, and many of the tests that are done, the results come from one day to the next, but some of the most important ones can take 2 weeks, 3 weeks
Right.
to obtain the results. Some of the imaging tests that are crucial for establishing the stage. So on one part, you have to establish the diagnosis, whether it's cancer or not.
Right.
And the second one is how advanced it is. And so imaging studies, scheduling can take sometimes months, depending on which country you're from.
Right.
Especially Canada, it can be months before they do a CT scan or a PET scan.
Correct.
So it's a time where the patient is still with tremendous amount of uncertainty. But I just want to say that the more information we have at the time of diagnosis, the better we can design the protocol for our patients.
Okay.
In these tests that may take a few weeks, like the histochemical analysis, where they do a genetic profiling of the tumor, is very important because you will know whether the patient is eligible for some therapies or not. But as soon as we know that a patient has a malignancy, certainly there are several things that a patient can start doing before all of the diagnosis is done and completed, so that we can design a better therapy for them. And so reading probably is the most important thing. And I would recommend my book, the latest book that I have, that's called The Art and Science of Undermining Cancer, so
Okay.
that they start getting information and knowing that they have many options, no matter how advanced, no matter how complicated, and that cancer does not have to be a death sentence.
Correct.
The first impact is, oh my God, I have to get my things in order because
Right.
you're dead, And that's the most stressful part of the whole process. And I think starting to get information and for this stress level to come down,
Right.
understanding more about cancer, more about all of the therapies that are available, and all the possibilities that a patient has to survive cancer, beat cancer, or live with cancer, I think would be very, very helpful. But beginning a therapy of any kind without a complete diagnosis is not the best thing
Right.
to do. And the rest is also stressful. Of course, improving your diet is going to be good, but just mentally and getting information, understanding a little bit more about what this disease is and what everything that out there that's available, I think can bring the stress level down, and for the patient to understand that having as much information as possible is very important, so that we can design.
The more information that you have, the more armed you are with that information. It can help lower the anxiety level,
Yes.
which is even because your body's so stressed with all that, the wondering of what's going to happen. So being armed with more information is certainly going to be helpful, and it can help lower. I've not had cancer. I've had family members with cancer that, of course, have gone through that as well. And what type of specific testing does Oasis need to be able to make a best decision if they're right for treatments at Oasis?
So the biopsy is paramount. Knowing what type of cancer. Biopsy gives you the type of cancer and how aggressive it is.
Okay.
And whenever histochemical analysis is very good, that's the genetic profiling of the tumor.
Okay.
And then imaging for us to know how advanced the tumor or their malignancy is. With those we can definitely be capable ourselves to design a therapy. Now, for a patient that has already been diagnosed and even received therapy, well, a little bit of the history of what the patient has done in the past, so that we can describe that or as part of the therapy. And so the biopsy, imaging, lab test, and the history of what the patient has done already.
Okay.
That is very helpful for us to be able to help the patient.
And for new patients out there, there is a medical new patient questionnaire that I or Oasis can provide for you to help guide the doctors in a conversation that they'll be having by Zoom with you. Now, I know that at Oasis, the dendritic cell immunotherapy is a main focus or main thrust of treatments there, and how is the dendritic cell drawn? Is that blood or is it tissue?
Both of them. The most important is a blood draw.
Okay.
For most of the patients with the patient's blood, we're able to develop their immunotherapy. So we draw from the patients several cells, and these are the cells that are going to be, the technical word is expanded. So we multiply those cells. We activate them against specifically the patient's tumor, and then we infuse these cell therapies back to the patient. And that is what is called dendritic cell vaccine. It's not
what is the time
when
they get to Oasis from that blood draw to the dendritic cell therapy? What is the time frame? Does it usually take your labs to do that?
Generally, it takes between 3 and 5 days to prepare these products. There are some, for instance, if a patient is coming specifically, or we feel that natural killer cells, NK cells, are absolutely necessary, that takes about 2 weeks.
Okay.
So we'll determine whether a patient needs NKs or not, basically when we get all the information, and we'll then let the patient know before they come whether we're going to do NKs or not.
Okay.
There are some patients that already know that the best for them and what they want is NKs, natural killer cells, and so that the preparation of that is about 2 weeks, 10 days.
Okay. About 2 weeks, and there are. Now, Oasis has been treating cancer patients for over 60 years.
Yes.
And of course, they're not the only facility that's available. So but I believe that Oasis was one of the first facilities to bring dendritic cell immunotherapy, to the area. What sets aside Oasis from other facilities? We don't have to go into names into those facilities, of course, but the what what is different about the dendritic cell immunotherapy at Oasis versus another facility? What makes Oasis stand out, I guess, is really what I'm asking.
You're right. We are the first ones to work with dendritic cell vaccines, and at the beginning, we were working with uh, an outside laboratory
Mhm.
and helped them develop this. But with time, we felt that we needed to improve the whole process and also make sure that we were, providing the patients with the correct elements. And so we have our own laboratory. That's what separates us from other immunological centers in Tijuana. We're the only ones with a center. We're the only ones with very highly qualified doctors of science in the field of expanding cells. And we have an extremely accurate quality control. So we know that exactly which cells we're giving to the patients, how active they are, and how many.
Okay.
And I think that we're the only ones to offer that kind of quality control to our patients. And because we have our own laboratory, we are constantly improving not just the process of whatever we're doing, but improving in bringing possible new variations of the therapy to our patients.
Okay.
And so patients that have been with us for sometimes have seen the evolution of the therapies as time goes by, and that can only happen when you have the laboratory there and you have the correct people that are able to promote these innovations and improvements to the therapy.
I know that Oasis, over the years of knowing Oasis and working with you, that the treatments are are expanding, and you're coming up with more and more treatments. When a patient comes in, I know that initially it's around 16 days. Typically, a stage 3, stage 4 cancers. Of course, I see with more people with stage 3, stage 4 than I would do in earlier stages. How often would you say that those patients would need to come back for the boosters of the dendritic cell immunotherapy?
Well, I really require 100% of the patients to come for the second application of the
Okay.
therapy. This is very important because we will then reinforce the cell therapy at that time. But the most important for me is to evaluate the response.
Okay.
And then depending on the response, we'll see what we have to improve or change, or if we are getting very good results, when is the next visit? So if a patient is doing very well, usually I will then schedule the next visit for 6 months or even a year when a patient has an extremely good response. But there are some patients where we need to make adjustments where the initial therapy was not enough, and then we have to go to stronger elements of the vaccine, where sometimes we need the tissue of the tumor, as you
Yeah.
were trying to ask me first, to obtain more antigens, because from the tumor circulating cells, we're going to obtain generally a good amount of antigens to prepare the vaccine, but sometimes they're not enough and we need tumor tissue. And when a patient is not responding well and we need to do the most potent element of our vaccines, which are called the tumor infiltrating lymphocytes, we need to bring the patient back and obtain a piece of the tumor,
Okay.
a large enough piece, about 1 gram of tumor tissue, to obtain the tumor infiltrating lymphocytes. And these are the most aggressive cells to kill that tumor. That's why the evaluation at 3 months is very, very important.
Okay. And then, and a lot of people aren't aware that Oasis has a team that is working with the patient whenever they come back home. So, Oasis doesn't just love you and leave you the day that you're after your treatment. You've got a team that's working with you and is in response. I've been part of that where the patients are getting the response from the follow-up team to make sure that things are moving along smoothly for them. So that's actually unusual with different facilities having this follow-up team that works so closely with the patient.
That's true, and I established that many years ago because the most important thing is a good follow-up.
Right.
The stress level of a patient is tremendous to begin with.
Right.
And it's difficult for them when they make a decision to come to Mexico because most people are going to tell them, "Are you crazy?" And so again, uncertainty is the worst thing that can happen to you. And what we want is the patients to know that we're just a phone call away.
Right.
There's always so many questions, and so you're right. We have a team specifically there to help patients with any questions that they have of whatever. And we are very diligent and prompt to answer the patient's questions and to guide them through the process so that they feel more at ease. And
right.
So the more a patient is at ease, the better the patient is going to respond. And so,
of course.
And there's no dumb questions.
I agree. I would say typical conversations leading someone up to helping them make these decisions are 30, 45 minutes at least. So that's normal. So when you're calling me, then you can expect that I'm going to take the time, just like Oasis is, to answer those questions for you so that you feel comfortable. You make a good decision for yourself. And not only is Oasis doing the dendritic cell immunotherapy, and I think they're the top in the field on that, but you have all the metabolic therapies, all the high dose IVs, and there's IPT, the hyperbaric chambers, hyperthermia, all the nutritional help. If they wanted to stay more than 14 days, is that possible?
Definitely. And we will let the patients know how important that would be or not.
Okay.
But there are patients that say, even if they're doing well, I just want more. And
right.
So yes, it is possible.
Right.
Necessarily, not necessarily, but we will let the patients know what would be available for them, and also depending on availability of rooms.
Right.
But there are some patients say, I just want to be around for a little bit longer before let's say that a patient is doing NKs and they finish the treatment and they still have to wait a whole week or 2 weeks to receive the therapy. Most patients would go home and come back.
Right.
But some patients want to stay in the area, and if we have room, they'll stay with us and they can have more of the metabolic therapy.
Excellent.
That stay, or we put them in a hotel nearby and they can go shopping and visiting.
And it's a beautiful facility, by the way. So for everyone, I'd encourage you to look around. There's lots of videos on it, and I can get more information to you on that. But it's a beautiful facility, so very well updated. It's a modern facility. And Doctor, I thank you for answering these questions, because these are questions that that I'm fielded on a daily, weekly basis about Oasis. And I hope you enjoyed our time here together, and look forward to setting up others with other additional questions here as well. I didn't want to absorb your entire day, but thank you very much for answering those questions.
You're very welcome. Thank you very much.
Oh, wonderful. Well, you have a blessed day, sir.
Same to you.
God bless. Sir. You take care. Bye-bye.
Bye.
I hope you enjoyed the video.
if you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.